So we are on week 3 already. It's going to go by very quickly. Always remember to think of that nursing pediatric assessment you want to do. What diagnosis do you want to use? You can find something weird and obscure. I love to learn things. Or you can give me something that you, your child, neighbor, friend, somebody had something and you want to know more about. And if you make it more interesting, it will be easier on you. You're not going to feel like it's such a chore to do this project. Remember, it's 3 parts. And I'm going to tell you next week to start your paper after you study for the exam. Okay? It's a great week to do the paper. And at least you got 1/3 of the project away. Remember, you can always submit these early. Let me know you submitted it. I'll correct it, send it back to you. I'll show you what real APA format looks like. So in the future, when you're doing community or another, mental health as you go forward, you'll know what an APA project looks like because I helped you with this one. So put forth your best effort, and then I will help guide you through the whole thing.
So you
So
want us just to submit it and to you
submit
and let you
early.
know?
We have multiple submissions. Send
Okay.
it in early, I'll correct it. I can't do everybody's the last week. All
Okay.
right. So week 8, I can't do everybody's. But if you send them in early, I'm telling you, I'll be able to do it. And then you'll get your 100 on your, um, for that, which is will help bring again your grades up. Usually a whole letter grade in the end with you if you have good homework grades. Remember this week we do have a CJ Sims. Remember, I need to see your name in the upper right-hand corner. That's the most forgotten thing. Again, if you see a 0, go back and look at the comments. It's going to tell you what you need to do. And I'm not going to take off the first CJ Sims if you don't give me all the 4 things I need. I need your name, which is the upper right-hand corner usually, the name of the Sims, the date, and the grade on it. If you see a 0, look, resubmit it by Sunday. I'll give you almost a week again to get it done. And then I will give you your grade without a deduction, the first one. Okay. I just want to make sure you submit them correctly because it's something that all the accreditors, again, they do look for that. And also 50 NCLEX questions. Be careful. It is not under pediatrics, it's under growth and development. Check infants, toddler, preschool, adolescent, school age, and do the growth and development on that. Again, if you don't give me the right NCLEX questions, you'll see a 0. And I will give you another week to get it done. Okay. So just be prepared for that. Those are the 2 missed things that I see. So I try to warn you and hopefully don't make you redo NCLEX questions or, oh my God, that CJ Sims, how do I get it? How do I retrieve it type thing. So anyway, this week, it's school age and adolescents we'll be going over. There is a exam review schedule. I put it out finally today. I got everybody's responses. I'm doing yours on, what is it, Wednesday for y'all? No, I do yours on Thursday. And I do it at Thursday. I do it at 2 p.m. Again, I will record it and I will put it in one place. You're going to see exam 1 review recordings. I will keep editing that same announcement so all of us are in one announcement. So you don't have to look out for 5 different announcements. I don't think that you have time to do that, especially with the 3 courses. I try at least to make you a little organized. And if you noticed when I gave you all the exam 1 stuff, you have all the Kahoots you in one place. You have your study guide there, and you do have a dosage calculation. It is very similar to the types of questions you'll see on the exam. If you can do those questions, you'll be able to do the dosage calc on the exam. If you cannot, meet with me. Give me 10, 15 minutes. All I need to help you learn how to pick the correct numbers out to do your dosage calc. I think missing math on an exam should be a given for you, and only those silly mistakes occur, not because you don't know how to do it, okay? I will help you. You just have to ask for that. So we're going to be doing the PowerPoint, and then we're going to go and do the Kahoot. So let's start with week 3, school age. We'll start with those guys. I think, this is, those children now. This is chapter 34. We know school age is ages 6 to 12. They start out with all their baby teeth and they end up with all their permanent teeth. So, and they beginning of menses too, puberty at that point. So there's a lot of growth at 6 years that we're looking at here. About 2 inches a year we grow at this point. So it's slow and steady. It keeps going. We know from 6 to 12, they're going to double their weight. And boys and girls are about the same. It is till they get to adolescence where the boys get taller and bigger than us. Up to that point, we're all about the same height and weight. So that's a thing with school age versus your adolescence. They start to get, thinner, taller. They're becoming more and more, muscles are stronger. The baby fat goes away. Now, by the end of it, the curves are starting a little bit. And then we know at age 6 is when we start to see all I want for Christmas is my 2 front teeth because the teeth start falling out, right? Now, it doesn't mean at age 6, everybody's teeth fell out. Christian was 7.5. The first one finally came out. And then all of a sudden, 3, 4 fall out. So again, we know that losing teeth at this age is going to occur. And it's not because their dental health is bad, it's because their baby teeth are coming out. But yes, if they do have cavities, cavities do hurt these children, and I'll let you know about it. Their whole body is getting more and more mature, right? They're able to hold their bladder longer. That means trips in the cars aren't as hard because they don't have to go to the bathroom, every hour like younger children, right? Their heart is now not in their chest like you can see the heart. It's in more proportion to the rest of their body. They have gotten sick how many times and gotten all of their immunizations. So their immune system's getting stronger and stronger and stronger. Their bones, where they used to be softer and more flexible, like their heads and cephalopolygy, um, we know that it becomes stronger and it gets ossified, we call it. So they're more, stiff, right? So again, they're going to break easier too. Another thing about school age children you have to be careful about. There are some children who look older than their age is. And I'll give you a great example. My second grandson, 9 years old. He's 145 pounds and he looks like a 16-year-old. But mentally, he is, like an 8-year-old. He's still a baby, a child that needs good explanations and understanding. So remember, physical maturity does not mean that their brains are there also. So again, how to get on their developmental level is why I'm mentioning that. Another thing that we start to see in school age children is all of a sudden you have a kid in school, and this is for those who want to be school nurses in the future. And it's a great profession because you'll be off all the days that your children have days off from school. So something that many of you might even think about. Remember, if you start seeing a kid that's really good and good in grades, and all of a sudden they are getting more aggressive, lacking attention span, or they're starting to complain their tummy hurts, going to the nurse a lot, like you're wondering what's going on. This is usually a sign of distress or stress. Something's happening. Could be a divorce at home, could be something's happening at home. This is the way that they know how to express it without talking about it. Because remember, they don't know how to explain it. Because remember, they don't know any differences. They just know it doesn't feel good what's happening. So, puberty. We know that girls go through puberty quicker than boys. I know that when I was 10 or in 5th grade, I thought boys were getting stupid, right? They're silly because we're getting more mature. Puberty's starting. And now I'm getting taller than the boys because we go through a little bit quicker. We know that when we start puberty, it's 2 years later the menses usually show up. And what is the start of puberty? How would you know? Well, in girls, it is breast buds start, and then in boys, it's enlarged testicles. And these are the Tanner stages, and it's something that we're going to look at in a second more. Now assessing a child. Again, we got to get on their developmental level. School age children, ages 6 to 12. What I tell a 6-year-old, it's not going to be the same thing I talk to a 12-year-old, all right? So a 6-year-old broke its arm, needs to go for an x-ray. If you've ever been in an x-ray room, they're moving it around. It's click, click, bang, bang, bang. And then even a chest x-ray, they think it's coming at them, and gamma radiation is going to zoom through them and they're going to die. And this is what little boys, school age children might think. So, how about it's a big, big camera. It doesn't touch you, doesn't feel you. It just takes a picture. But guess what? We can look at your insides. And then what I do is I will show them the picture of where that break is. Let's say it's a bone, or maybe it's a pneumonia and there's a consolidation. And then they understand and they're not going to be afraid because x-rays are scary if you think about it. You inspect, you auscultate, you percuss, you palpate. This is a lot with the abdomen. Lymph nodes. It was one of the Kahoot questions, and we're going to revisit that. You should not feel them unless they're sick. Healthy children don't have lymph nodes. Um, Look at health assessment. How do you assess the hypoglossal nerve? Well, even infants will try to imitate you sticking a tongue out. So it's a great way to do that. Now, one of the things with children is breath sounds because a lot of children have that upper airway mucus, nasal mucus, and they don't know how to blow their noses that great or cough it up like we do older. So, a lot of times you're going to hear referred breath sounds down in the lungs. So, how do you assess the upper airway, which is more your bronchial up in here, or when you're really looking at the lungs? If you take the stethoscope and you put it right in between the clavicle bones and listen, you're going to hear that gurgle. That's upper airway. And then you can go lower and listen to the lungs. So when you have a kid, when you go to your clinicals, and they have a little upper respiratory mucus, look at the difference. Listen to that upper airway that it's mucus, so it's referred, and then listen to the lungs, and you're going to see how mistakes are made. Oh, they have bronchi. No, they don't. They have upper airway mucus. Now, Freud, anything about sex, right? So, what is sex about school age children? Well, basically, what he talks about is now relating to other people. And the other people are same sex peers in school age, most. I'm not saying all because there's always exceptions, but most of all, children, girls hang out with girls and boys hang out with boys. And that's what we call same sex peers or latency. Why that word latency, I don't know, but that's what we need to know about him. Now, Erickson. Erickson is all about a sense of industry. Oh, gee, what does industry mean? Well, think about industry as a factory. This is what a child produces. Their industry is I'm good at math. My industry is I'm really good at running or hitting a ball. Okay. That's what I do well. All right. And a lot of times, children will run faster or be the first to raise their hand with math questions or spelling questions because they're really good at it, because they like that peer approval. That's what motivates them to like it more. Now, the other part of industry is industry versus inferiority. Well, I can't do everything well, can I? And that's what I feel inferior about. There are children who are smart, who are clumsy and can't run, can't kick a ball. I'm going to feel inferior about that. And we know children tend to be that teaser, oh, you can't run, right? So that you do feel inferior. So, one of the most tested is your trust versus mistrust and school age, industry versus inferiority. So you need to understand what that means. And I think the way I explained it, you should remember it. Now, Piaget is cognitive, is thinking, is putting things together. All right. So now they're starting to understand things that they've seen before, they can replicate it. They can't think yet, like in, formal like operations, which is thinking and they can put everything together without ever thinking or seeing it before. They're starting to understand things like, you remember the preschooler, if I had a nickel, it's bigger than daddy who has a dime. Why? Well, the nickel's bigger. Well, then as they get to be school age children, they're now understanding it, that wasn't the correlation. It was that's worth more than this one. They're starting to get that. That concept of conservation is weird, but it basically is sort of like the nickel and the dime. It's a glass of milk in a tall, skinny glass or in a short, fat one. If I take the short, fat one and pour it into the tall, skinny, it's still the same about amount of liquid or milk, whatever you poured in there. But a younger kid would take this tall one because it looks bigger. So that's what those things are all about. Again, they understand things that they've seen before, and now they're starting to think a little bit more and understanding more in depth about those. And that's more pictures of different things of conservation and the thought process. Let me see. Concrete operations. Again, same thing that I said. Another thing about cognitive development is feelings for others. Again, how many children you have a school age and child, let's say they're preschool kid, they're 5 years old or 6 years old, and they see mommy on the couch not feeling well. They're gonna go get their blanket, or they're gonna go get that whatever in the refrigerator that you wanted, because they can see you don't feel well. They want to please. I'm not going to go into formal operations yet. I'm going to do that in adolescence. Let's just think of concrete operations, which is I've seen it, felt it, touched it before. I can replicate it. Formal goes into now I can think, and that's adolescence, which is your older school age. Now, Kohlberg. We have had it where infants and toddlers really don't understand right and wrong yet and the consequence. They really don't. Maybe the older toddlers, but in the book, they don't understand it yet. It's when they become that preschooler, it's reward and punishment. I do good, I get a reward. I do bad, I'm going to get a punishment of some sort. That's what you need to know about preschoolers. Now, school age, they want to do right. They want to please. They want to, do what has to be done, right? Because they're pleasers at that age. Their spiritual development, again, what they've seen and saw is what they know in spirituality. Have they gone to church? Have they seen the manger? Or they just know Santa Claus or the menorah or whatever that, of that spirituality that you've had at the house. They only know what they've seen so far. But they're curious, like, who is this, power that's higher than me, that what a god for whatever the word of that god might be. The other thing about school age children with spirituality and God, that higher power, is if I do something wrong, I'm gonna get punished. And I fell down and broke my arm because yesterday I hit my sister. So I did something bad. I expect something wrong. And they truly, truly believe this. A great example is I've had many school age children come in, their appendix. They need an appendectomy. They were in appendicitis with the pain. And I know school age children believe this thing. So before they go to surgery, I would sit with them and I'd look at them very seriously and tell them, you didn't do anything wrong. Okay. Nothing made this happen. Is sometimes that body part says, I don't want to work anymore. It's not that you did anything bad. And I want you to know you can watch the shoulders just drop like, oh, okay, it wasn't me, it just happened. Because they feel more bad things are coming. And it's a very real thing for school age children. As I said, social development is all about same-sex peers. And we know that they start getting interested in activities away from school, or within school groups, the Boy Scouts, the Girl Scouts, or art club, or whatever it is. They're going to go where their same-sex peer friend goes, and very well influenced in that. If one child wants to play basketball and the other kid wants to play soccer, it usually they'll decide on the same thing for each other. So they will switch even what they want to do for their same-sex peers, okay? Now, clubs, peer groups, all of those things. Remember, in any sort of club, sports, etc., we're going to see that bullying. We're going to see that one person who thinks they're all that in a bag of chips, right? And I can kick that ball farther than you. And why are you even trying? And that bullying's there. That's why parents and the parental person watching this group needs to be very aware of these things, and parents need to talk to their children about, so how was practice today? Or, in that game, I saw this, tell me about it. It really can help them express, the way they're feeling, because sometimes there's that underhanded little bullying that goes on. And families at this point, parents, they don't need to be their friend. They still need to be that guiding factor that helps them, through these things, but not as a friend, but as a grown up that gives advice. Now play. School agers still play, all age children. I still play, and I'm an old lady. I mean, every area of, growing up, there's always play. We know that play has rules and rituals. As they get to be school age children, these are more, they could play more of that cooperative play where there's a goal, like checkers and playing Scrabble or whatever game is of the, season that's popular. They can play that, and we know that they can play together as teams, and we also know that they can play all by themselves. And what they're doing is, let's say they're learning to play piano because they want to. It's all about their ego and making them feel good that, yeah, I can do this. And then having people listening go, ooh, you play really well. We know that school age children, as I said, it's, that they're starting to learn about themselves and what they do well, what they look like. They're looking at the freckles, the eyes, the hair. I wear glasses, they don't. This kid's good at math and I'm good at running. And they're starting to understand those things where earlier they didn't really look at that as much. And again, those significant adults, whether it's the teacher or the person who's leading the Girl Scouts, whatever, is helping them and guiding them along. And it's always trying to give them that positive experience and feelings of goodness, that self-respect. As I said, they're starting to learn all about the differences, in children, and with that, it's children with hearing aids and children with glasses. Braces, a big thing, right? Is again, these children are going to feel less than because the other kids don't have it. So it's again, it's the parents, the significant adults that can help them. Oh, those are great glasses. I wish I could have a pair like that. Those are pretty cool, right? They got blue glasses. I mean, who else would have blue glasses? So, in the beginning of school age, they've gone through preschool and they've started kindergarten and now they're getting into first grade. And again, it is now, where do children go every day? 5 days a week, usually. It's, their second family, their second house. This is where they're learning about the world, learning about dealing with other people, having patience and being able to sit for longer periods of time. And as we get older, those peer relationships are more and more important. Nutrition, nutrition, nutrition. This is a great time to teach children, school age children, about anything, whether it's about drugs, whether it's about nutrition, and having these children knowing what foods are good, what should they eat. And we know that the quality of that diet is, the families, some families can't have fresh fruits and vegetables on the table all the time, and they have to eat what they can eat, but again, it's teaching this school age child what would be a good alternative. There is fast foods that we give. I mean, just think about today. Two parents have to work to make any house income work. I mean, that's just today. And then you're in school and you're working. What are you going to do some days? You're going to run through, Taco Bell and get dinner or McDonald's or whatever. Remember that fast food has a lot of fats and carbs in it. And those things, can become a problem because you might get that overweight child, which is more problems. One of the ways that we teach children about nutrition is an internet program called My Plate, and it looks at all the food groups and what should they have in a day. So it's something they should be introduced to. So as was mentioning, obesity, childhood, these school age children at this age, there is more risk today. And I think a lot of it has to do with either the neighborhood they're at, they can't go out and play because it's not safe, or there's no one to watch them as they're outside because mom and dad have to work till later. And then you're that latchkey kid, right? You have to go home with your own key and get into the house. So they said, no, go in the house. You can't go out to play till I come home. There is also all the technology. Children today, Roboblocks, right? This is what all of them want, and they want Roboblocks dollars. I was asking my two older grandsons, 11 and 9, what do you want for Christmas? They want money to buy stuff for their video games. And these children, what do? They play video games and computers. They're on, telephones, and they will be there all day long if you let them. And what are they doing? They're not moving. And usually they're sitting eating snacks. So what happens? These children could become more heavier, no, heavier, or become obese because they're not moving the way that they should. One of the things about overweight children is as they get older, there is a higher risk for hypertension, diabetes, and cholesterol. It's that due to cardiometabolic changes. You put that extra fat and sugar and weight on them, you do have that more chance of being that adolescent type 2 diabetic, and it can happen. So, why are we teaching school age children all about these things? Is because we can prevent things. We can prevent that diabetes and we can decrease the incidence of high blood pressure and diabetes due to being overweight. These sort of things that we do to help prevent obesity should start when you're pregnant with a child. Feeding that baby intrautero the nutrition that it does need. I mean, there is no specific culture, ethnic group. No, it is across the board. They're all the same. And as I said, school age children are a perfect group to teach because they want to learn. And again, they want to please, right? Great group to teach. And one of the things the book says, school age children should not be forced to finish their plate of food. Because what that does is later on in life, they're not going to be able to leave food on their plate. And guess what? They're going to get heavy because of it. And I can't tell you how many times I'm sitting there watching my daughter and her son, who's this skinny little thing. Um, you're not getting up till you finish all your food. Now, it shouldn't be done because as I said, they get older and they're going to overeat and then they could have a chance of obesity. Now, sleep. Well, infants sleep a lot. Toddlers sleep a little less, preschoolers same, school age. They should have about 9 to 11 hours every day. We know bedtime as a 6-year-old is a lot different than a 12-year-old, right? 6-year-old, you're gonna have to do that bedtime routine to get them calmed down and into bed. But as they get older, they're just gonna go to bed. I'm tired. Good night, mom and dad, and go to bed, right? Sports. Well, one thing about sports, we can't start them too early. Okay. This is according to the book. There's a lot of different personal reasons, yes, no, but they say early participation with that bullying that self-esteem could be crushed because they're not as good as another child. Remember also, sports, it's just not the kids, it's the parents in the stands. I've gone to, these sporting events with my young kids and my grandson, and these other parents are screaming and yelling, "You missed that ball, go get it." and you hear other stuff too. Again, that could work on their self-esteem. We know kids love competition. Whenever you play a game, what do they say? I win. I won. It's all they want to do. They want to win. And again, we know that a lot of times we, with children, instead of doing activities, sports outside, riding their bike, we know it's going to be cell phones and what's that influence that they see. YouTube. Oh my goodness. Get on there and they listen to all of these videos. And are they all good? Again, there should be a certain amount of time set for that. And then they need to get up, out, and go outside and play when it's safe for them. I mentioned a little bit about dental health, and we do need to make sure that they brush their teeth at minimum before they go to bed. I mean, yes, in the morning before school, but before they go to bed because they don't want that sugar from their dinner, etc., on their teeth and sleep on it because it will rot their teeth. Now, losing teeth, is it a sign of poor dental care? Well, they're losing teeth because they're young kids. Now, will they have pain with cavities? As I said, absolutely they'll have pain. But one of the things that children do is they'll fall, especially like I've seen it mostly getting out of the pool, their hands slip, their front teeth go down on the side of the pool, and a whole tooth comes out. What do we do with that tooth? Can we put it back in? It's their real permanent front teeth tooth now. What are we going to do? Well, root and all, don't touch the root, only the bottom part that you would see. Put it in cold milk and get to either a pediatric dentist or a place where there's a pediatric ER and they can actually numb it and push it back in and it will catch if it's done in that proper manner. I've seen many child come in with their tooth and thank goodness they had it in milk. Why cold? Why milk? It's just what works best. I think the cold prevents any bacteria from growing, so there's no heat. And I think the milk is something with calcium, if I had to think about it. And it does. They put it up there and it does work. Sex education, they're getting more and more curious, right? They're into sex play, mom and daddy, right? We also know that they're going to continue with touching themselves, absolutely normal. Uh, in the other room, you're not going to really see it as much now. As they ask questions, again, find out what the child knows before we start explaining things to them. A 6-year-old is going to be different than a 12-year-old. Again, as I've said, treating sex is a normal part of growth and development, and the questions are going to be there. Again, trying to figure out what they know, and then just give them enough information so they're fine with that. School health, as I said, great, great profession. The school nurse as someone where if you can't talk to your child about sex, and my mother never did, the school nurse was actually the one where I saw the movie all about menstruation, and I had no clue what that meant. But she had to sign a permission form. I still didn't know what that meant, but it's a great person to get information from. Again, as they get older, they'll, written and verbal information. And this is a great source for it. School nurses have really good access to community resources, and it's something that these nurses will be really well involved with. So, a child staying home alone, I've just had a question. And when is a good age? Well, you have these legal battles, right? What the law says being home alone. And then you have, is it supervised, unsupervised? Is somebody there for them? You know, there's not really a cut answer there. There are many children from very young have been given the key and, they have to go home because nobody is available to watch them. um, with even after school care, etc. So, and it depends on the mentality of the child. Are they able to follow directions, right? Can they follow directions, or um, is it somebody who does need observation all the time? Because latchkey kids, which is that comes home alone with no parents, have a higher incidence of accidents because they're not supervised. So, they need to be told what they can do and can't do, but kids are going to do what they want anyway. So that's a loaded question. There's real no answer for it, because the law would tell you one thing, right? Now, injury prevention. When we talk injury, we talk about all age children. The answer is always motor vehicle. Motor vehicle is always number one, whether they're in the car or ran over by a car. And I've seen many children ran over, backed up over the car in the driveway. An aunt, a mother, and a neighbor. Those are three I can remember. Yes. I've seen good outcomes and I've seen not so good outcomes. So again, as I said, preschoolers start that increase in motor vehicle type of injuries because they're out in parking lots, crossing streets, getting balls. They're given more freedom. They're behind the cars in driveways. They're riding their bikes around sidewalks, their cars parked in driveways. It is an increase. So again, it's something that families need to work on in education. As I said, a risk factor for injuries is that stressful family environment. That's the kid who's now in stress, who's now being restless, not that nice kid, grades are falling, complaining of tummy pains. They're going to have increased injuries because they don't care. They're in this environment, they're not happy. Do you realize that children should be in the back seat till they're 13 years old? I never did. Reading the book as an older person, I'm like, oops, I didn't do right. They used to call shotgun, right? Booster seat should be till about 8 years old. And again, that's just to keep them safe. ATVs is a big thing down here in South Florida, down in Homestead, down on Chrome Avenue. You'll see ATVs all the time, all age kids on them. It is not recommended for any child under 16 years old. And why? Well, they're not alert enough or have enough information to figure out if something bad happens, what are they going to do to save themselves? So, under 16, they should not ride an ATV. And it's like, well, the parents can watch. Okay, they get on the ATV and they're gone. They're a mile away before they're going to come back. And in that mile, they could get in trouble. Remember, safety equipment for everything. My little kid just got a hoverboard for Christmas. He has a helmet, elbow pads, wrist guards, and knee pads. And he has fallen and he hasn't hurt himself. But again, whether it's sports, whether it's football, soccer, baseball, whatever, make sure they have proper equipment because without the equipment, probably going to have some sort of injury. With it, you have a decreased chance. The thing about school aging parents, so for the first 6, 7 years, that mother and father are mothers and fathers, and they nurture and they take care of their children. And now they want to go over to their friend's house. So they're not home as much. And it's a difficult time. As they get up even to adolescence, as a parent, you've got to give up the kid. And you don't want to. You want them to be your baby forever, right? Now, as a school age parent, they need to be taught that you gotta let the kids again, just like the toddlers and autonomy versus shame and doubt. Autonomy is they need to try things, and they need to learn from those things. Because remember, they are pleasers. So you've got to let them try. So you need to be that sitting in the back watching and to be that guidance as they need it. One of the things, school age disorders, ADHD. What would you say? This is a child who is inattentive, hyperactive. They start a task, they start a game, and they go from one to the next to the next to the next to the next, and they don't finish anything. So when we talk about ADHD, it's always that hyperactivity and that inattention. One of the things school age children, because they can be that child's a little bit disruptive because they can't sit. It's just part of their, disease. They can't sit. And school age, the school nurse is one of the ones who's called in a lot because they're sent to the office or sent to the nurse when these things are going on. And then they pull in the parents. Many times, parents have done so much to try to help their child. It's not that the kid is spoiled, right? That's always what they say. Oh, the kid's just spoiled and doesn't want to listen. Well, you don't know what's going on at home. So if you're a nurse, you need to first listen to what the parents have done, not just say, it's because you're doing this and that. No, listen to what they have to say, and together you can make a plan of care. And uresis. What's the other word for this? Bedwetting. Now, there are children who get potty trained and never, ever wet the bed. There's also kids who never have been potty trained and up to the age 8, 9 are still wetting the bed. Not necessarily every night, but they are. And then there's that child who all of a sudden starts sweating the bed. That's the one you need to be concerned about the most. Is it because of a disease? Think about diabetes mellitus. What's the symptom of it? Increased urination. What about diabetes insipidus? What's one of the symptoms? Increased urination. All of these things could be part of it. So again, listening to the parent, what if it just started or they never have, etc. And then again, figure out the plan because it could be a disease that's causing it. Encoparesis. This is when they are constipated. They're not moving, but they're getting all this extra stuff come around it that comes out. And you'll see soiling in their underwear. Again, let's find out why. Is it just we need to change the diet, or is there something structural that's going on? And when you have a child that's quote constipated, it is the only thing that they can control. And many of them will hold their stools to get some sort of attention. I've seen it in 3 and 4 and 5 year olds. They haven't stooled for 10 days. And you take an x ray, and the whole bowel is full. Again, is finding out the why. If is it, something psychological, physical, or we just need to increase the diet in fiber. So a child has a avulsed or knocked out tooth. The parents are reluctant to try to implant the tooth. Where should the tooth be placed for transport to the dentist?
Cold milk.
In cold milk. And what they do is they'll numb it with some numbing cream and let it sit a good while. And then the dentist comes in and they put it in and they swoosh it up there pretty densely, but it doesn't hurt because it's been really numbed. And then they put them on a very soft diet. And then they're visited in the office like 2 days later to check on it. I'm telling you, most will reattach if it's done properly. Don't touch the root, only what you can touch on the outside. Put it right in cold milk. Don't rinse it, don't nothing. Cold milk and bring it into the doctor. So, adolescence. I call this the roller coaster ride. This is where the children are becoming adults. They now, at the beginning, are going through that pre adolescent growth spurt. and they grow 20 to 25% of their height in about 2 to 3 years. It is quite dramatic. This is where the boys get taller, and now the girls are shorter. They're physical, cognitive, social, emotional. They're maturing at their own rate. Okay. We know it starts out with those first secondary sexual characteristics, breast buds on girls, enlarged scrotum on boys, right? So basically, what I just said right here. Remember, with girls, the start of their menstrual cycle can be irregular, right? Again, they're getting really tall, they're gaining weight, the hormones are going crazy, they don't know how to handle it, and they can be really, really moody. This is normal, okay? We also know, as I said, menstruation starts about 2 years after puberty. And the one thing, because of now that sexual curiosity as an adolescent, they're going to be starting these 3-dose series of HPV vaccine. Girls and boys both get it, starting at age 12, and it's 3 doses. Now, as I said, I was going to show you Tanner stage. There's been Hesse questions on this. What you need to know is, one is they are a child. 5, they're an adult, all the body parts. It starts with the breast bud, it starts with the increased scrotum, and it goes to all the hair and all the curves and all the, the genital is like an adult. So if you can say 2's the beginning, 5's the end with questions, you'll be able to figure where it's going to be in between there. As I said, they start growing really, really fast at this time. And sometimes we see with obesity, you'll see some girls have early menarche on those girls. Now, let's go into our theorist, Erickson. So this is another one that you're going to see. As I said, you have your infants, you have your school age, and you're going to see adolescents. What are adolescents all about? Who am I? What do I want to be? Am I like girls? Do I like boys? Do I want to be a doctor or do I want to be an engineer? Do I want to hang out with the sports group or the drama group? Trying to figure out who I am. It's sense of identity versus your role analogy. Who am I going to be? Where am I going to place myself in there? One of the biggest things with Erickson is identity. It's not liking themselves. I'm too fat. I'm too skinny. I have too many pimples, right? My hair's too curly. I can't stand it. I want it straight. It's all of these things trying to figure out where they are. Because of all of this inward thinking of me and not liking themselves and body image, this is a group that you need to be concerned about suicide. Any warning sign or an expression of wanting to die needs to be taken seriously. You might see them sleeping too much, not enough, becoming irritable, eating too much, eating too little, not wanting to go out with their friends, or talking about death. This is something, take it seriously. And even if your son or daughter has mentioned it about a friend, it needs to be taken seriously. Social development now, away from mom and dad. Now they're into what I call the buddies in them. Peers. It doesn't have to be boys, girls. It's all of the peers that are in the group they want to be with. They want to be with mom. That's the ambivalence. And they do, like their parents to an extent, but they don't want them telling them what to do. And I want to be with my friends and I want to do what they're doing too. Again, they need to be accepted by their peers, whether it's in sports or in drama or art or whatever group they get into. They need to be accepted. And they need to like themselves, their body image. As I said with parents, this is the roller coaster ride. They it's what we call turmoil and ambiguity. It's like, I don't know what I want. I want you, but I don't. I need you, give me money, but I don't, tell me what to do, is, that confusion that's going on. Yeah. At about 15 to 17, that middle adolescence, this is where we start getting those conflicts over independence and control. You need to be home by 12 o'clock. And the kid goes, "No, I can't come home. That's too early. Everybody else is out till 2." And you're like, "No, you need to be home at 12 o'clock or you can't go out." And they're gonna fight, they're gonna go against it, they're gonna, kick and scream. It's what they want to do. And it creates all of this tension between, the parents and the child. They think because of the responsibility, they've done this and that and do what they're supposed to do, they should have better privileges. Well, it's part of that frustration. So if parents were to ask me what should they do, well, it's always try to sit down with your child and work out some sort of contract of what they can both agree with a lot better. Sometimes they need to go to school nurse or go to a therapy session figuring out what they can do for these children to work better with their parents. Peers, as I said, are very, very important. And that's where they feel good. That's where they belong and they feel that strength and they feel good about themselves. Your best friend as an adolescent is going to, how you treat them is how you're going to treat your partner of life. This is where they start to understand the importance of that best friend, okay? How to build rapport with an adolescent as a nurse. Well, I worked in an ER the last 10 years, had a lot of adolescents, and you've got about 3 minutes for each person, each, kid that comes into the ER to build up a rapport. So, what do you do? How do you do this? Well, it's number one, be observant as they walk in the door. I would say they're listening to music on their earbuds. So, what music do you like? Or I might see a Yankees hat. Oh, I'm from New York. You like the Yankees too? Or maybe you talk about, have you decided on a college yet? Now, I'm breaking open a little bit of conversation. Another thing, especially today, let's say you have a girl walk in who's dressed more like malish. So I would say, so what would you like me to call you? Because it makes a big deal. Are they a Rachel or are they a Ray? I mean, and these things do happen. And when you do that, that adolescent is going to, wow, she understands and will talk to you more because we know that getting a sexual history from an adolescent, they don't want to talk about it. What we can do is have parents leave the room. Now, you've already built up this little rapport. Parents will leave the room and you can say, "So tell me what's going on." I don't have to tell your parents what you're telling me unless you're going to hurt yourself or others. That, of course, you do. But you could be that person they talk to. It could be that girl who's having these urinary tract infections and, they say they're having sex. Well, you can tell them things like, well, it's been shown if right after sexual intercourse, if that's what you're going to do, that you urinate and that decreases and immediately after. That's going to decrease chances. So it's those little things as nurses we can do. Adolescents are hard to get that. Also, remember these adolescents are going to tell you things that you're going to jaw drop. Try not to let your jaw drop. Just continue to listen. Oh, okay. All right. Because it's happened to me before. As I said, adolescents, a 3-shot HPV. We know it's for cancers for girls, but we do boys and girls. Another thing is nutrition in adolescence. Remember that body image? Too fat. So what do these children do? They get a power bar and they get a bottle of water. They put it in their backpacks and they go out for the day, right? And then they save their monies because they're saving money to get that new shirt or to go to the movies. Because mommy's not going to give you other money for that, right? So they don't eat the way they should. So again, let's look at their body weight. Is it going up? Is it going down? And try to figure out why. And anytime you're evaluating nutrition, any age child, it's that diary. what did you eat today? What did you eat yesterday? Or keeping a 24-hour or 7-day diary so that we can look at what are you eating. Always think a diary about food. Sleep and rest. These kids should be sleeping a lot. Didn't I tell you in the beginning, they're growing a lot. The first couple years, they do need rest. They don't. It's because they're studying. They're on their phones. They got a new boyfriend, right? And then we got to go to the ball game. We have a dance. We have a this. We have a that. They don't sleep the way that they should. So it's just part of it. They should exercise a little bit every day. And also the teeth. We got to make sure that they do brush their teeth and floss it every day because it again, it's their permanent teeth. Sexuality, we know sex is all over the internet, sex is all over the TV. Again, adolescents who are asking questions. Some parents, like I'm telling you, mine, I never knew about it. The day I got married, my mother asked me if I thought about birth control. The day I got married, I'm like, okay, mom, but where could we direct those children? Well, the school nurses, Planned Parenthood, if it's still there, right? And parents, if they will, it's nurses, adolescents, without parental consent, you can give them written and oral information. You do not have to get approval from the parents, okay? Again, safety, motor vehicle, right? And now they're driving. So now it's really, and it's not just the driving. What do adolescents do? And I've seen it and I remember it. Getting on the hoods of cars and driving around parking lots and trying to get that, swoop that kid off the side. And then they're thrown onto pavement, right? These are the injuries. Firearms. Oh, I'm old enough. I can handle daddy's gun now, and the gun goes off. It happens. And of course, sports injury. Usually, children in sports at this age, they get a lot of good feelings about it. Many of them want to get sports scholarships. So they're pushing their bodies to the end. So those injuries are huge at this age. So Matt, 14 years old, that's that pre-adolescent growth time, seems to be always eating, although his weight is appropriate for his height. The best explanation is what? He's getting bigger. He needs food to fill the tank so that it can accommodate that height and weight that he's going through. All right. Who wants to win a Kahoot today? Nobody? William, you want to win, don't you?
You know I'm here for you, ma'am.
Yes, you are. You always are. All right, let's try. I believe there's like 39 or 40 questions today. Not too crazy. So again, remember, please listen to the reviews and listen to mine and somebody else's, all right? Professor Morris does hers on Saturday morning. She is detailed, very detailed. You got a bee boop? They used to call me Betty Boop. I, at my hospital today, am still known as Boop, Betty Boop. Even the patients, Boop, there you are. It made me less threatening. Here we go. Week 3, going quick, quarter of the way through. How does the onset of pubertal growth spurt compare in girls and boys? So remember, school age most of the time, no difference between girls and boys. And then they get up to that pre-adolescent growth spurt. We know girls are going to start that breast buds first, and all of a sudden, boys are silly or stupid, as I used to call them. So it's 2 years before boys. Girls grow up. That's the hormonal part, quicker than boys. Multi. Which activities are appropriate for a 6-year-old child? So competitive sports, no. 6-year-old, really mentally, it's hard to handle because of all the bullying and all that feelings of not, putting the kid down when they don't do things right. Not quite yet, according to the book. Okay. Hopscotch, jumping on one foot, hopscotch, jumping rope, and riding a bike. Absolutely all of them they should be able to do. That's gross motor skills. At what age should a parent expect to have major conflicts over independence and control with their child? I want to go out till 2 in the morning. Nope, you're coming in at 12. And it's that middle adolescent, 15 to 17. Very good. Signs of the onset of puberty in girls. What happens first, according to Tanner's? And that's development of breast buds. Good job. You heard me. The onset of puberty in boys is characterized by. That's testicular enlargement is number one. What do we use to determine if a female has reached the age of menarche? When you look at a physical female, what are you looking for and how do you measure it? And that's Tanner stages. Remember, you're going to see Tanners, and just know that one is no development and five is complete development. And number one, again, starts with breast buds and enlarged testicles. So, knowing that those other in between, you can figure out just about where they are. Are they complete or not? A child goes to the ER with a low fever, pruritic rashes, and open oozing papules. Nursing care includes. What do you think that is telling you? And this has happened quite a few times to me working in an ER. And I was always in the triage area. And this could be chicken pox. And chicken pox is airborne. Okay. So, first thing, put a mask on you and then get that child a mask on them and get them into one of those negative pressure rooms. Even ERs have them to protect all the other children, which you have a lot of them with, they're immunosuppressed due to many reasons. The source of injury, whether intentional or unintentional, in adolescence is associated with what? What did I tell you? Injuries equal what? Motor vehicle accidents. Whenever you hear injury, any age child, the most is, believe it or not, motor vehicle. A 9-year-old friend tells him soccer's a dumb game and he should play baseball. Why is he saying that? What's that all about? And this is all about same-sex peers, and it's all about pleasing them. And we know that peer acceptance is very, very important. That's their first outside the home person, is their best friend, their same-sex peer. So they want them to accept them. During admission, the father of his 16-year-old says, "We are Buddhist. Culturally competent in care includes what?" I had moved from a town in New York where there was hardly any different variations in culture. And I moved to Miami. And what I learned, the best thing is when I didn't understand, I would ask. And parents and children both, they were like, "Oh, you don't know?" I said, "No. Could you teach me? I'd like to know. I'm interested." And when you do that, you've gained a lot of trust with, the parent and the child. So ask. When teaching sex education and contraceptive for adolescents, what should the nurse consider? Can you teach sex about that to adolescents? And birth control pills, condoms, can we? Yes, we can. And remember, teenagers, you don't need a parental consent. And what you need to do is give them oral. And remember, not with your opinion, just information, oral and written, so that they can look at it and they can seek, treatment, as they can. Die. The management of adolescent obesity should include. What did I tell you about diet, obesity? How do you manage that? So remember, the one thing about managing it, let me know what you're eating. And when I'm looking at what you're eating, you can incorporate some sort of favorite food in their diet. They don't have to like not eat just carrots all day long. You can include something, but instead of giving them, regular ice cream, maybe it's a low fat ice cream or a low calorie ice cream, whatever it is. Now, diversion, that's for younger kids. And would you like a carrot as a nutritious food as a method of reward? No. You would like that little bit of ice cream, okay? So it's not a reward to get a carrot, a nutritious food. Which action would improve dental health in the school age child? So when a child is in first grade or like 6 years old, they don't have the ability to floss yet. So it's usually the parents need to help up to that point. But flossing when they're able to, and that's what that means there. They should floss, their teeth, whether with parents helping or by themselves. And that does improve dental health. An 8-year-old child says that she has cancer because God is punishing her for being bad. Why is she saying that? This is an absolute common belief. Remember, I told you the kids come in with an appendix and they need to take it out. And I would tell them, listen, you weren't bad. You did nothing wrong. You're not being punished. It's just that the appendix just didn't want to be there any longer because they feel they broke their arm because they hit their sister, whatever. They do firmly believe this. And I've heard it over and over and over again on your school age children. So it is a common belief. A 6-year-old needs to get a chest x-ray. What explanation is the best? So remember, X-rays and kids, especially little boys and Spider-Man and all of these, heroes, they're afraid they're going to get radiation rays just going through them and burning holes, etc. So it's just as simple, take a picture. And I always let them look at the pictures because if they see the break, then they understand, yes, your bone is broke, and they can see how it's broke. Very important on these kids to show them. How can you get an adolescent to be more receptive to talking about their health and sexual exploration? So most adolescents won't talk in front of their parents, have them leave the room. And yes, you can give them written and oral information, and you don't have to tell the parents what they said unless it's something that's going to help hurt that child or somebody else. A child is a knocked out tooth. Where should the tooth be placed for transport to the dentist? You know this one already. And we know it's cold milk. You don't want it in a clean, dry jar because it's going to dry out. We don't want that. A nurse planning care for a school age child should know which thought process is seen. School age children, what do they understand? Thought, Piaget, cognitive. Remember, this is that ability to conserve, okay? Magical thinking is your preschooler. Conserve is that they know the difference between a glass of milk, whether it's short or tall, or a penny, and a quarter, which, a nickel and a dime, which is worth more money. That's when they start to think more. It's what we call ability to conserve. I know it's a weird word, why it's that, just to make it confusing, right? Which stage of Erickson would you use for a school age child? What's a school age child all about? So, school age children have their house, their industry, and they produce a product that they do really well, but they don't do everything well. So, it's industry, it's their house. I do really well. The inferiority, I can't do everything well, and I wish I could. I want to do everything right. 'Cause remember, they're pleasers. School age children's moral development, Goldberg. So infants and toddlers, they don't have that moral development yet. In preschoolers, we know that there's right and wrong and a consequence for each. And they become school age and they want to please. They conform to rules. They want to please, okay? As they become adolescents, there's rules of society that they have to follow, like stopping at the red light, which, opening doors for people, or just, you can't do this and that certain places. It's knowing what is right and wrong on the community level, not just personally. Multi. Anorexia nervosa characterized by. I don't go over a lecture in this. We know that there is eating disorders. We know that older school age children and adolescents, this can happen. And we know there's two types of eating disorders. Anorexia nervosa, they feel that they're too fat, and anything they put in their body is going to make them fatter. So, fear of weight gain, severe calorie restriction, unrealistic body image. It's exercising like crazy. It is diuretics and stool, making themselves stool, laxatives. That's all anorexia nervosa. Now, the other one is bulimia. And bulimia is they eat, but they vomit it. And whenever they eat, they're going to vomit. Now, how would you know which one it was? Well, if you vomit all the time, you have stomach acid, right? Your teeth are going to rot. If you are that person who's been bulimic for a long period of time. And those are the things that you need to know about eating disorders, okay? So, what behaviors would you see with a child with bulimia? So, this is eat, vomit, vomit, vomit. All the others are going to be your anorexia nervosa. What's an adolescent's heart rate? So we know infants, 140 to 160, that's your neonate. Maybe up till 1 year, maybe it's 100 at the lower one when they're at sleep. But adolescents, remember, those numbers go down and down and down as we get older. And then we get to that adult 60 over 100. Adolescents are a little bit lower, only because they're younger, the heart's more effective and efficient. When talking with an adolescent regarding personal health concerns, which is most important? So just give them that opportunity to express their open feelings and be honest and listen. You need to give them that time. And again, try to keep the jaw from dropping because you want to. A parent says the infant puts everything in their mouth. Based on Freud's theory, you would respond. You're always going to see me put a concept in from the week or so before. It's just we're making sure that you understand them. What is Freud all about? Anything sex, right? Everything in their mouth is all oral. So that's the orality. And they explore the world in their mouths, everything. A multi. What could be a sign of potential child abuse? I wish I never saw any type of child abuse, but I've seen quite a few, more than I would ever have wanted to have seen. But remember, as a nurse, you are responsible for the child. So, one of the big things is inconsistency between the injuries that you see and the history they're trying to give you. Many times that kid doesn't want to talk, they're afraid to. And if you get that child alone from the mom or dad, they're going to have different stories. And that is those couple of things that you might see. In school age conflict of industry versus inferiority, what does industry mean? Industry, my factory, my house, what I produce, right? It's that mastering that task, whether it's playing sports, whether it's math or science, it's mastering something, being really good at it. What my factory is, what my product is, what I produce well. What clinical finding does not indicate an adolescent may be suffering from anorexia nervosa? Remember, bulimia, you're vomiting, and that stomach acid rots the teeth. So, what is not anorexia nervosa? They've got good teeth. They don't have decaying teeth. Cooperative play. Ooh, what's that? You need to know your plays for the exam. Parallel play next to each other and not together. That's toddlers, a very important one. Preschooler, two or more playing together with no goal. And cooperative, two or more together, and there's a goal, whether it's building a house, playing checkers, somebody wins. That is those what you need to know. You're going to see it again. What does moral development involve? What does Colbert say? So, moral, Colbert, right and wrong, and a consequence for each. Those are things that you'll see regarding that. Developmental milestones are important to observe because why do I need to know a kid's not rolling over by 10 months? Why do I need to know they're not walking by 18 months? Why? So when you see a kid behind, not doing what they're supposed to do, these are those clues that can tell you early interventions needed. It could be speech therapy, occupational, physical therapy, any of these things. Get that kid up to where they need to be. And the beauty of children, they catch up really quick, but you've got to give them early as possible intervention. Which of the following immunizations is given in the adolescent stage? And that's your HPV. Influenza, we can start at 6 months. Okay. What's the first immunization we give? Hepatitis B. Those are some immunizations you need to know. ADHD most likely involves which of the following? And remember, inattention, distraction, impulsivity, hyperactivity, they don't finish anything and move from this to this to this to this. And it's hard for them to sit still. Many times these children are sent down to the school nurse. Remember that school nurse needs to listen when they bring the parents in, find out what they're doing at home, and then give any more insight into helping these children. These children don't know why they're like that. They need to find out ways how they can calm down and to pay attention and finish tasks. A multi. An adolescent's been brought into the ER with a drug overdose. What are some initial questions you need to ask? Part of the assessment. They're in there, and at that point, we're able to talk to them. What do you need to know? I mean, on this is how you're going to give treatment to this child. We want to know what they took, when did they take, and what method. If they take it orally, it's going to last longer. IVs actually, an IM is shorter and a long nasal. So How quick did they get the drug? Did it react? How long is it staying in there? And what did you take? Rehab? We're not talking rehab yet. Right now, they're overdosed. We have a critical problem. We need to take care of what's at hand and then worry about rehab later. A 9-year-old recently has stomach pains in schools. Also, this child has become aggressive and stubborn. What's the reason for this? So, whenever you see a child who recently starts with this and has recently become this aggressive, it's usually that sign of stress. Many times it's the school nurse who now they keep going to this, to the health office because they don't feel well. That the school nurse will recognize it, but it is a sign of stress. It's the way the child knows how to show it. And last question, a multi. A nurse teaches a safety course in the school age children about their community. What should she include? So, fear of strangers, school age, they should know that one already. But water safety, that's a big one, especially if you live in South Florida like I do. Um, Microwave. This is especially that child who's that latchkey child who's going to go home and make macaroni and cheese in those little cups. They need to know how to use that microwave. And of course, appropriate car restraint. Remember, booster seat to age 8, and they should be in the rear seat to age 13. Okay, let's see how we did today. Abby, good job, Abby. And Silly Goose, number 1. Tia, good job, Tia. Number 4, HS and a U. All right. Interesting things we call ourselves. So that is today's class. I'll be sending you the recording. I'll be sending you the Kahoots. Please make sure if you decide on your assessment project, send it to me so I can approve of it. Because I'm not going to have 10 of the same thing. I like a little bit of everything. It keeps me interested and keep reading these projects. I'll be giving my review on Wednesday, so please be there. And anything you need from me, if you need to, when you go over that dosage calculation, if you need help with it, let me know. I will get with you 15 minutes. I don't need a lot of time. I'm not going to take a lot of your time. You're all too busy. So if you need me, holler. I'll be here for you. Any questions? Bye, guys. Anybody want to go over the exam and the quiz?